As the number of confirmed COVID-19 cases continues to climb in our area, officials on Long Island are holding a press conference to update the public. Let's take a listen in.
Like the county, are really on the front lines of getting information out, getting the facts out, reassuring people, and keeping them calm. So I want to thank them for what they're doing during this coronavirus outbreak and also what they do every single day to help things run better in our county. So thank you. We have Bishop Lionel Harvey of the First Baptist Cathedral of Westbury. He is also part of our team here at the county. We have Rabbi Herschel Billet from Young Israel of Woodmere. We have Pastor Roger Williams, First Baptist Church of Glen, Cove. Dr. Isma Chowdhury from the Islamic Center of Long Island. And from the Long Island Muslim Society, we have Rafika Rahman, who is the chair of LIMS, and board member Shuaib Kandakar as well from LIMS. Thank you for being with us. We have Rabbi Dalia Bernstein from Congregation Beth Or. Where is Congregation Beth Or?
Belmore.
In Belmore. All right. Thank you for joining us. We have Sedgwick Easley, who is the pastor of Union Baptist Church in Hempstead. Have I forgotten anybody? We have Lisa, our interpreter. Thank you very much for being here. We want to make sure that we're communicating with everybody. So we just got a little bit of breaking news as we were coming up to the podium. The number of confirmed positive cases of COVID-19 in Nassau County is now 13. So when we went to bed yesterday, there were 7 confirmed cases. This morning, we've got 6 new cases. Of the 6 new cases, I do not have information about ages, locations, or genders at this time. We're going through it all now. We'll get it out to the press and the public as soon as we possibly can. Of the first 7, 6 are part of the same cluster in the town of Hempstead, and we have an additional 1 in the town of North Hempstead. The one in the town of North Hempstead, we are still investigating the cause, the contact, but we do not believe this person, this man, is related to the first 6. We have 40 residents in mandatory quarantine. That number will increase because of the new 6 numbers. That number will increase, so just expect that to happen. And we currently have 72 people in precautionary quarantine. We also have, how many tests pending do we have now, Doctor?
We still have about 20, and that's going to increase as the contacts are evaluated.
So we have about 20 tests pending, and as the doctor said, because we're going to be doing investigations into the new cases, we go through their contacts, where they go to school, where they go to work, how they get to work, if they've traveled, if they've been to a family gathering recently, going through those contacts. So it is very likely we will have more tests pending. You know, as I've said, and I think we need to repeat this to reassure people, that our department's health investigators, disease investigators are out there working closely with our state health department to continue to investigate any other possible cases by going very systematically. There's a routine for this. It happens all the time. We just don't hear about it because it's usually not such a high-profile thing. We also are going to expect increased testing capacity now that Northwell Labs has come online with testing, and we know that with more tests will likely come more positives. I want to reassure the public that many of our departments, OEM, Health Department, Police Department, Office of the Aging, IT, are all on the front lines of this outbreak, and we're all working very hard to protect the health and the safety of our residents and to get the information out there. Again, you can never say it enough. If you don't feel well, please stay home, call your healthcare provider, use hand sanitizer, wash your hands. There's nothing that beats good old-fashioned soap and water for 20 seconds under the sink. And before you go anywhere, if you're not feeling well, stay home. Now, we know if there is a silver lining that most people who contract the virus will either be asymptomatic or have mild symptoms. But because there's no vaccine and there is no medication, we have to be very cognizant of our seniors, people with compromised immune systems, thank you very much, and people with underlying respiratory issues. We have to protect them, and that's why this containment and isolation of those who are not well is so incredibly important. We do have a core of 1,000 reserve doctors, nurses, experts, and medical professionals who are volunteers, who are trained to step up and help us, and they've been very helpful in this, and I thank them for that. You may have heard that over the weekend, Governor Cuomo enacted emergency powers, and that basically means that our county, like all the counties, will have more access to federal and state money, more resources. It allows other good health care professionals other than doctors and nurses to administer the tests, and it allows EMTs to deliver patients to places other than hospitals should we need that. Also, as of 9 a.m. yesterday, our Office of Emergency Management launched what is called a soft activation under Commissioner Morelli's leadership. Basically, what that means is the Office of Emergency Management will work very closely with the Fire Marshal's Office, with the MTA, with our police department, and others to make sure that we're all working together and tracking the information as it comes in. Tracking is a very important part of this. Want to caution everyone, allergy season is about to start, so, you know, if you're feeling that tickle in your throat, it doesn't necessarily mean coronavirus. It could, if you're someone who suffers from seasonal allergies, you already know what that feels like. I also want to announce this morning, before we turn it over to the clergy, and the reason why we called this press conference today is that I was supposed to give my State of the County address on Wednesday at 7 o'clock at Elmont Memorial High School. I'm going to postpone that State of the County. I feel that it's very important that we marshal all of our resources to deal with coronavirus, to make sure that we remain on the front lines, that we're getting the information out. And as I said, we've got the health department, OEM, police department, IT, so many departments and agencies are on the front lines working hard, and I don't want to distract those resources. I don't want to distract those people from this very important job. So our number one priority is the health of our residents, is the safety of our residents, and now is not the time for the State of the County. That can wait. So I had the opportunity to go to a church called Truth Center in Port Washington yesterday. And I saw they had the hand sanitizer there, which was great, you know, those things where you push the thing up on the pedestal. But people still want to hug and kiss. They want to shake your hand. They want to give you a hug. They want to give you a kiss. We're seeing friends and family at church or mosque or synagogue or shul, wherever we go to worship. But we have to take a break from that for a while. You know, it's hard to get out of your routine. We're always saying people touch their face more than they realize. That's a routine we have to get away from so that we don't transmit the virus into ourselves. Maybe we need to take a break from shaking hands for a while until the worst of this is over. You know, as I say, most people will be fine, but we got to look out for our seniors. We got to look out for people who may have a compromised immune system. We want to hug, kiss, and shake hands, but I don't know if you guys agree, but I think we need to take a little break from that. So we're doing what we're calling the Corona bump. Right? We're doing the Corona bump. It's the new thing to do. All the cool kids are doing it. We could give a peace sign, right? You could always give a peace sign if you're Catholic, when it's time to give the sign of the peace. You could smile. Or you could do as our Muslim brothers and sisters do, and just a nice touch to the heart and a little bow. There's nothing more gracious than that. So also, if you're not feeling well, stay home, please. People do not want you at church. They love you, but they don't want to see you at church if you're coughing and sneezing. If you find you can't help it and something comes over you and you have to cough and sneeze, do this. Don't shake hands. Wash your hands as soon as you can. And when you're not feeling well, please stay home. So I would like to turn it over now to Bishop Harvey, and then any other clergy member or religious community person who would like to come and speak. Actually, before I do that, Kavan, would you like to say anything?
Sure.
Yes.
Sure.
All right.
Good morning. First and foremost, I want to thank the county executive for exhibiting great leadership in putting together and gathering all of our houses of worship. Obviously, as we work forward together to ensure that we try to make Nassau County residents as safe as possible, it's important that when we do have gatherings such as we have in many of our houses of worship, large gatherings, that we're practicing and generating the same levels of protection for our seniors and for our families. As we go forward with this is very new, as we're seeing and experiencing all throughout the country. It's something that we're going to have to adjust to in our everyday lives, and I think the county executive talked about it in regards to the Corona bump and making sure we're washing our hands and we're using hand sanitizer. I walked through the building today and I saw many hand sanitizers just on my way into the office. We have to continue to exercise, make sure that our staff is experience and knowing the precautions to be able to take place. But obviously, having such a distinguished group of clergy here today with us, they're on the front lines as well. Every single day, our houses of worship are open to the public, to their congregations, and it's important that they continue to administer and issue safe precautions so we do not continue to spread coronavirus throughout their congregations. I also want to take the opportunity to say, as the county executive said, that this could be passed through with not even knowing it. And you can have it and show mild symptoms and not even know that you are a carrier of it, but then pass it to somebody who could have a compromised immune system, and they can have tremendously different symptoms. So it's important that we continue to express good personal hygiene, continue to wash our hands, continue to use hand sanitizers, continue not to touch your face, and continue to try to do those things to make sure that we do not spread it, and be able to work with our Dr. Eisenstein, who's done a great job in making sure that the legislature has been aware. And as you may know, the legislature is preparing to do a hearing today at 10 o'clock to be able to gather as much information that we could provide to the public as well. Much of it has been provided already, but continue to elaborate on that as well. Thank you again, County Executive, and thank you to all our members of the clergy.
Thank you. I'll turn it over to Bishop Lionel Harvey, and if any other one wants to speak, please do. The more we hear from you, the better. Thank you.
Thank you, County Executive. We really appreciate you, and to Legislator Abrahams and to my fellow clergy who are assembled here. As you do know, as pastors and as leaders in churches, we come in contact with many different people. Our primary concern, as the County Executive has already stated, is to make sure that we ensure that our people are well taken care of, and we err on the side of caution. Some of the things that we've done at the First Baptist Cathedral of Westbury, where I pastor, I also work here with the County Executive in the Office of Minority Affairs as the Deputy Director of Diversity and Community Engagement. But what we've done successfully is we've been able to kind of mobilize our ushers and our greeters, and we made sure that they put on white gloves so that we don't have as many contacts with the doors. So they'll open up the doors, they'll close the doors, and they'll make sure that our people are not just touching that on a consistent basis. We've strategically put hand sanitizer in different areas so they continue to sanitize their hands. And we're doing not the corona bump, but we're doing the holy bump, the holy elbow, we call it. And people got a kick out of it yesterday. They were really excited about it, but we took some time to explain to them how very important it is to kind of minimize any kind of contact that we do have. We like to kiss and we like to hug and we like to embrace one another, especially the elderly people. When they come in and you haven't seen them for a while and they come back to church, to our synagogues and to our temples, you want to embrace them. And it's important that we just don't do that. Sometimes the kids have problems because they just love to hug one another, but I think they've got a better immune system than we do. But even with that, we're trying to teach them to do the holy elbow. And I think if we keep doing those types of things, we'll be able to be successful in what we're trying to do. I also want to commend the county executive for having the foresight to cancel a State of the County address. I think that just shows the type of person that she is, and I thank you for being concerned about us more than some of us are concerned about ourselves. So I'm going to turn it over to any other clergy that would like to speak at this time, and thank you so very much.
Hi, I'm Rabbi Dalia Bernstein from Congregation Beth Or in Belmore, and actually we're right about to celebrate the holiday of Purim. It starts this evening, and there's this concept of v'nahafochu, and you're supposed to turn the threat on its head. It's actually a very joyous holiday, and we take any threat that we're experiencing and we try and move through it by not taking it too seriously, although in this situation we're taking our health and our safety very seriously, but we're moving through it. And at some point we're going to be able to look back and we're going to be able to say that as a community, with our safety precautions, we were able to really take care of ourselves and take care of our loved ones. And there's another concept that you're supposed to live by observances, of rituals, but not hurt yourself by them. So even though we may want to kiss a mezuzah, which is a ritual box that's on a door. You may want to kiss it. It's an opportunity for you to be able to glance at it, but perhaps not to actually touch it. For Jewish communities that are in a synagogue and they see a Torah scroll which processes around the sanctuary, we also want to reach out as we want to reach out to each other, and we want to touch it and we want to bring it close to us. And this is going to have to force us all to use our intention rather than our hands, to really set our hearts towards what is important to us rather than physically showing it. And in some ways, it's going to be able to show us and one another that we have a deeper connection beyond what is physical. Last but not least, I think that there's an interconnectedness to the world that unfortunately we're experiencing right now, but in some ways it's actually remarkable to see how much we're affected. Our communities are connected one to the other. We don't even see its underlying connections, and I think it's very awe-inspiring and eye-opening. So holding all of this together, we're trying to be as mindful as possible for those who are more at risk in our communities, and so that we can be stewards of health for everyone.
Thank you. And I just want to say, speaking of Purim, it's the season of, let me know if I'm saying this correctly, Moshe Kapoya, which everything is upside down. That's sort of the fun part of Purim, and it kind of feels like our world right now is experiencing some Moshe Kapoya. But I know with time we will get it on the right side again.
Good morning. I'm Isma Chaudhry. I'm the chair of Islamic Center of Long Island. With me from LIMS, which is an Islamic center in, in East Meadow, I'm sorry. In East Meadow, I have my colleagues with me over here. This is a time of concern and carefulness, but not chaos. And I would like to commend the county executive, her team, our great Department of Health, because they have everything under control. We, as representative of people of faith, we have to keep our faith. We have to make sure that our congregants are not nervous. Being careful is always great. Again, these kind of small challenges bring communities together. They should not have us standing against each other or targeting one community or the other community. This is the time to come together and deal with this situation in an intelligent, smart, humane way. In our congregation, Friday is a congregational prayer for the Muslims. We are shortening the prayer, again, as the rabbi said, that faith has to bring spirituality. It is not about numbers, it's not about hours, it's not about minutes, it's deeper spirituality that has to come out. So we are shortening the Friday sermons. We are making sure, because we prostrate on the carpet, so we are making sure we're taking all those measures where our congregants are not in any harm's way. In the mosque, we have an increasing number, like other congregation, of our seniors who come to the mosques, like other congregations. We make sure that they are well protected and they are not in any harm's way. Once again, this is the time that we should all come together and deal with this situation without being in a state of panic. Thank you very much. Thank you.
Thank you.
Good morning. I'm Cedric Easley, pastor of the Union Baptist Church in Hempstead, New York, and I commend our county executive on this morning for calling us together. We have taken precautionary measures at our church, particularly of having hand sanitizer all throughout the church. Also, it is important for us as a people of faith, we oftentimes, at what some would call pass the peace, the moment of fellowship hour, we do the bump, but yesterday we didn't do anything. We just nodded our heads and kept going with our services. Very concerned in regards to our senior population. We do have a senior housing building next door to us, and we also serve a food pantry on Fridays. And so we are trying to take as many precautions as possible to make sure that everyone is safe. I do want to ditto what my colleague said in regards to handing out or passing out proper information so that we are not in a panic. One of the things that happen oftentimes in these moments is misinformation. And what we are trying to do is to give out correct information. So certainly I'm grateful because when we don't get it from the proper sources, numbers begins to change. And we want to make sure that we have the proper information in these times and that we are able to work together. This coronavirus shows us just how small the world is and how much we are really connected one to another. And so we're doing all the precautions, and I'm grateful to have this opportunity to dialogue with colleagues in ministry that we may continue to join our efforts together to do what's best for the greater need, for the greater community overall. Thank you.
Good morning, everybody. I'm from Long Island Muslim Society, and as Sister Asma says, we are going to shorten our Friday prayer also. So, God does come to talk to us. I think it is one of the signs that you work together. We pray for all the creation because we believe one creation. And if you see the history, this type of episode came long time ago, how they prevent it. So we follow that also. So we pray for everybody, especially our county executive, that she is doing a tremendous job. We see every time, every moment, she is thinking about this county people. May Allah keep her in good health so that she can serve everybody as well as all of you. Thank you so much. God bless you all.
Hello, everyone. I'm Roger Williams, pastor of the First Baptist Church of Glen, Cove, Long Island, New York. I want to commend the county executive for her vision and getting us out in front of this challenge for our communities. Being at the First Baptist Church of Glen Cove for the years that I've been there, we've had the privilege and the honor of being the host of a soup kitchen that has met a lot of needs, providing for people a meal every day, and also social services, providing for them information to bring uplift and to give them mobilization in the community. What we have found with those who come to the soup kitchen, many of the clients there are in the most vulnerable positions that we can find in our communities. And so working with Estelle Moore, who is our president, we're working real hard to make sure that we have some very good measures set in place to make sure that those who are the most vulnerable, and by the way, the ones who can be the first on the line of contracting or consuming this virus, that we're doing the very best we can to protect them and also to keep the spread of it from moving into other areas of our community. And I want to encourage other churches who have service-oriented community events in your church where people outside of your membership participate in things inside your edifice. Make sure that you're working hard to make sure that those people are treated well but are protected at the same time. So thank you very much once again, County Executive, and for everyone working together on this. And we know everything will be well. Let's keep the faith.
That's right. Good. That's
And we've been watching Nassau County Executive Laura Curran give an update on the coronavirus outbreak. And we also heard from faith leaders speaking about the precautions houses of worship are taking to protect their members, such as discouraging contact, like shaking hands. Instead, they say to do what they call the holy elbow bump. And also leaders say drinking from a common cup at communion has been temporarily paused. Now, let's go over those most recent totals once again. In New York State, more than 100 people have tested positive for the virus, and a state of emergency is in effect in New York State. We just heard that the number of confirmed cases in Nassau County has grown to 13 overnight. Over the weekend, Connecticut announced its first case, and 6 people in New Jersey have now been diagnosed with the virus. And we will continue to bring you the latest on the coronavirus outbreak here on CBSN New York. But first, we are going to take a quick break, and we'll be right back here.